Hello, I'm Nikolai Miller, and I will be talking briefly about ADD, ADHD diagnosis, and the side effects medication has on a child's development. I was surprised to find that it is becoming a common study of whether mental disorders are overdiagnosed as we move into the future. The first study I found was by Ava Merton. She concluded that we are experiencing a trend of overdiagnosis of several mental disorders. They surmise that this is possibly due to the use of heuristics and relying on methods not used to correctly identify the symptoms and indicators of various mental disorders. Although this paper was investigating several different mental disorders, they did investigate ADHD, and they used research of Katrin Bruckmuller's paper. In that paper, they ran an experiment to see if therapists were adhering to the criteria laid out by the Diagnostic and Statistical Manual of Mental Disorders 4th edition, or DSM-4. Sadly, they found what they believed to be true, and that therapists were using a prototypical idea of what a child with ADHD exhibits versus the actual criteria found in the DSM-4. They found that of the vignettes that were used, 16.7% false positive diagnoses were given to non-ADHD vignettes. In an analysis of the female vignettes, they found no significant differences between the false positives of 11.3% and the false negatives of 7.5%. However, males, they found a much larger false positive of 21.8% to the false negative, which was 6.6%. This illustrates two things. First, boys are more likely to receive a false diagnosis based on their gender, and secondly, that females have a very slight higher chance of not receiving a diagnosis when they need one based solely on their gender. Why this matters is that a correct diagnosis as earliest as possible will only allow the child a better chance during their development. We need to start understanding how we can correctly identify what constitutes behavior linked to this disorder. In the paper by Allah Hamed, the researchers seem to find some of the consequences of a child not receiving a diagnosis when needed. They concluded that our communities are still not fully educated on the signs and symptoms of someone having this disorder. They also elaborated on how it can fall on the whole community surrounding that child to be better versed in identification of symptoms, and should include not only the family but also their educators and healthcare providers. If left untreated, ADHD can have a serious impact on the child later in life, to include psychological, financial, academic, and social burdens. This paper also found a direct correlation between a person not receiving a diagnosis when needed to a higher chance of developing a comorbid disorder such as anxiety, depression, personality disorders, antisocial behaviors, and substance abuse disorders. Untreated ADHD has also been linked to a higher rate of criminality according to this exact same study. So, as you can see, a proper diagnosis can be very beneficial to the development of a child, and why we need to be more vigilant in understanding our role in the identification of this disorder. As I found in the paper, Attention Deficit Hyperactivity Disorder Medication Use, Factors Involved in Prescribing, Safety Aspects and Outcomes by Jose Martinez Raga, that most of the side effects of ADHD medication are very minimal. This came as a surprise to me, especially from all the tales I was told at a very young age of the side effects that people would experience if they decided to use ADHD prescriptions to help them study and focus without actually having this disorder. This was a common wives' tale told to me as a child, and I believed it all the way up until very recently. While the study shows the side effects are minimal and almost non-existent, there is an ever so slight chance of some types of cardiovascular complications. For years, we have used mainly stimulants to treat this condition, but have recently seen an increase in other methods being used to either diminish the need for stimulants or to successfully replace them at an older age. Despite this, we need to be careful in issuing out a diagnosis for this disorder, because we do not want people to be receiving treatment that they don't actually need, or in a worst case, receiving treatment for a condition that they have that doesn't actually help, i.e. they have a different disorder, but they're receiving something that's not actually going to help the disorder that they currently have. Although there are almost no serious side effects related to treating a child who does not have ADHD, there can still be side effects not associated with the medication. What I mean is the social stigma of having a disorder that you don't have, and the possibility of another complication being the problem. We as a society need to stop relying on a diagnosis of ADD and ADHD as a solution to any form of unwanted behavior during the development of our children. While it may be easy to just say that a child has a disorder and some type of medication will fix their unwanted behavior, we are starting to delve into a possible future where we are setting our youth up for further complications in their road to development. Although taking the current medication does not pose any serious risks to their health, there is a small chance for issues to arise later, as well as the problems associated with trying to develop with a possible stigma or misunderstanding about yourself as you progress through life. After going into further research on this topic, my beliefs about how we react to the diagnosis and treatment of children with ADD and ADHD in our society, we need to become more educated on mental disorders. I was almost misdiagnosed with ADD when I was in elementary school, and the entire basis of that diagnosis was on what my current teacher told the administration staff. Luckily for me, I did not have the stigma of a mental disorder looming over myself as I continued my development, but there are those who are not so lucky. These individuals could be trying to grow and develop without the correct treatment they need or receiving ineffective treatment for something they don't have, all while trying to navigate the critical years of our life. As with the research I found and my own personal experiences, it has become more evident that we need to be better versed in our identification of these disorders to better help our next generations during their development. Thank you.